Hi everyone. Today we are going to talk about how to screen for obstructive sleep apnea. The major points we're going to talk about today is what sleep apnea is, how it affects our oral health, the different types, and how to screen. So first off, what is sleep apnea? Sleep apnea is a sleeping disorder in which a person starts and stops breathing multiple times throughout the night. How does this affect our oral health? Three major concerns is bruxism, TMJ, and dental caries. Um, Bruxism, it's an oral habit of clenching or grinding of the teeth. This condition adds extra stress on the teeth, causing them to be cracked or worn. Why is this associated with sleep apnea? This is because bruxism is more common in patients with sleep apnea. And then, quoted from the Sleep Foundation, 1 in every 4 people who have sleep apnea grinds their teeth. TMJ is another issue, the temporal mandibular joint. That also causes a stress and strain on our oral cavity. And then finally, dental caries. As you know, when people stop breathing multiple times a night, it causes them to have dry mouth. When a patient has dry mouth, it decreases the amount of saliva in their mouth. And without saliva, we are at an increased risk of caries and erosion. So an interesting thing when I was doing my shadowing hours for the hygiene program, I shadowed at Dr. Leisler's office. That's in Baldwin City, Kansas. I was a shadowing hygienist, and every single patient that she had, she would be working and then just stop and be like, do you have sleep apnea? Have you been diagnosed? Has anybody ever told you that you snore or stop breathing throughout the night? I found that very interesting because it was, I mean, almost every single patient that day, she asked that. But what got me was when the dentist came in, he would be doing his exam, and he would do the same thing. He would stop and ask the same exact questions to the patients. So once the patient left, I was talking to the hygienist, and I asked her like, why are you guys asking each person this question? And she had told me that um, they went to a CE and they were told that most of the time you can tell when a patient has sleep apnea because they have erosion in the posterior buccal teeth, and that's like a common sign. So they ask those questions, and then they hand out referrals for people that are interested in getting a sleep study done. So I thought that was pretty interesting, that I've had happen. There are 3 different types of sleep apnea. We have the obstructive sleep apnea, the central sleep apnea, and complex sleep apnea. Obstructive sleep apnea is the most common type of sleep apnea, and that's the one that we are screening for. This is caused by narrowing of the airway. It restricts the oxygen into the body, and it causes a temporary cessation of breathing. So that's where the apnea comes in. When a person stops breathing. Central sleep apnea is this form is more neurological. It's where the brain doesn't send the proper signals, and then the complex sleep apnea is a combination of both the obstructive and the central sleep apnea. Okay, how do we screen for sleep apnea? There are different tools and questionnaires, but as we all know, we are hygienists or trying to be hygienists. We cannot diagnose sleep apnea, nor can a dentist. We just screen for this and then send our referrals for the patient. A doctor actually has to do this, not a dentist. So the tools that I have found is the Malalampati. This tool is a classification system. I got it off of the Georgia ADHA website. And this is a just a visual exam that we as hygienists can do. It's 4 different stages or classifications. You have the first stage is where we look inside the patient's mouth and we can see the bottom of the uvula. We would score that A1. That's because the airway is open. A 2 is when we look inside the mouth and the tongue is partly covering the uvula, it would be a 2, and that's because the airway is mostly open. A 3 is when we look inside the mouth, and if the tongue is almost covering all of the uvula, the airway is mostly closed, so that would be a 3. And then the high risk is a 4, and that is when we look inside the patient's mouth, and if the tongue is fully covering the uvula, it's we consider that a very closed airway, and that would be a 4. So that is one of the tools that we can do a visual exam. Oops. And then another one is a questionnaire that we would ask our patients. This questionnaire is a common questionnaire that I had found. It's called the Stop Bang questionnaire. So you would ask your patients these questions. Stop stands for, so do you snore loudly, loud enough through a closed door? Do you often feel tired, fatigued, or sleepy during the daytime? Has anyone observed you stop breathing or choking or gasping during your sleep? Do you have or have you ever been treated for high blood pressure? So you would ask the patients, they would say yes or no. And then the bang portion is the body mass index is for B. It has to be more than 35. A person's age, if they're over 50. The neck circumference, so if it's greater than 17 for male and then 16 for female, and then if your patient is male or female. All the studies or the research that I've came across, it does state that most of the time it occurs more often in males than females. So with this questionnaire, they would answer yes or no. So you would have a category that you would place them in. If they answer yes to 0 to 2 questions, it would be a low risk. If they answered yes to 3 to 4 questions, it would be an intermediate risk. And then high risk is answering yes to from 5 to 8 questions. That high risk, we would get the proper referral for that patient. So in conclusion, it is our job to properly screen our patients, just like our oral cancer screenings. This is just a step closer. We see our patients more often than they see their primary care. So this is just the next step to help ensure our patients care for themselves and for their oral health. This next slide is my works cited. That's all I have for today. I missed you guys and I want to get back to school. I guess I will see you guys hopefully soon. Bye.